Welcome to the weekly checkup on ReachMD, your source for the latest medical education, breaking news, and various editorial topics. This week, we take a look at a new wearable device for hypertension detection. Easy to use, the device functions via a cuff placed around the patient's arm that is linked to a device worn at the hip. This allows the patients to move about their regular routine and provides more detailed readings. In the past, clinicians have struggled to detect cases due to white coat hypertension, which occurs when patients have higher blood pressure ratings during doctor's visits due to stress or other factors. Furthermore, patients' blood pressure levels can fluctuate throughout the day. For this reason, round-the-clock monitoring of blood pressure offers physicians a method to identify previously undetected hypertension. To learn more about new diagnostic technologies for hypertension and other related topics, head to ReachMD.com or listen to any of our programs on the ReachMD mobile app. ReachMD highlights Mental Health Awareness Month with our very own playlist. Learn more from ReachMD host, Dr. John Russell.
Hello, I'm Dr. John Russell, here to talk to you a little bit about Mental Health Awareness Month. This May, ReachMD will provide a special mental health playlist of carefully selected programs on a variety of neurologic and psychiatric topics. Hear from experts in the field as they discuss everything from stroke to schizophrenia. Learn more about the latest diagnostic and treatment options by heading to www.reachmd.com/mentalhealth.
Once you've brushed up on the latest in mental health care education, switch gears to check out the latest episode of Everyday Family Medicine, titled Zika Virus Basics, What You Should Know. Dr. Jennifer Caudle walks you through resources available to help keep your patients safe during this outbreak. Finally, learn how to better communicate with your patients in the latest episode of Speaking Of with Karen Friedman.
It doesn't matter how good you are at what you do if patients can't understand what you're talking about or what you want them to do. Words like non-compliance, regulatory, or standard of care are often meaningless to them. So it's important to tailor your communications to your listener. Think of talking to a parent, colleague, or even a child. Would you deliver information the same way to each? Not likely. Try using examples, analogies, and even draw from your own personal experience to make sense of information for these very different audiences. Finally, realize that values, beliefs, and terminology vary from culture to culture. It's important to draw distinctions and not assume that everyone understands information in the same way. For ReachMD, I'm Karen Friedman.
To watch more of the Speaking Of series, visit ReachMD.com or download the ReachMD app. On behalf of everyone at ReachMD, thank you for joining us today. I'm Marshall Miller, as always, inviting you to be part of the knowledge.